A pleasant day to all of you. We're here to discuss our systematic review entitled Effects of Patellar Taping on Pain Reduction in Patients with Patellofemoral Pain Syndrome. The purpose of this systematic review is to present currently available evidence of patellar taping to investigate its effectiveness in controlling and reducing patellofemoral pain, which is directly correlated to its pain-related outcomes measures and aid in clinicians' decision-making. For our information sources, PubMed and Google Scholar were systematically searched, which identified 1,960 related studies using relevant keywords with the following inclusion criteria applied to studies: subject diagnosed with PFPS, pain assessment such as BAS or NPRS, RCT study design, and published English full-text studies between the years 2010 to 2021.
Out of 1,960 studies identified, only 330 potentially relevant studies was considered after removing duplicates. Then 304 studies were excluded based on the title or abstract. 26 full-text studies were assessed for eligibility, and 20 of the full-text studies were excluded with reasons. Hence, 6 relevant studies was included in this review. The data synthesis of our systematic review revealed that 5 out of 6 studies utilized KT treatment combined with therapeutic exercises. In the study of Gunay et al., pain was significantly reduced in all 3 groups, with stretching and strengthening exercises applied during 6 weeks as 2 times a week, with a VAS scores in KT group reduced to 30 out of 100, as compared to group 2 and 3 obtained a result of 20 out of 100.
However, in a study by Etar et al., results had no significant difference in pain reduction between Group 1 kinesiotaping group with 50 to 75 degrees tension and Group 2 placebo kinesiotaping in patients with patellofemoral pain syndrome. In a study by Melo et al., they investigated that kinesiotaping without tension group promoted pain reduction after 72 hours, where the lower the tension constitutes to greater sensory effects, resulting to produce pain reduction through promotion of gate closing channel and blocking passage to nociceptive stimuli. Similar to this study, Cart et al. Examined that the KT application group, which utilized vastus medialis oblique facilitation technique associated with patellar correction in patients with patellofemoral pain syndrome, demonstrated substantial improvements in visual analog scale.
Additionally, the findings of Sanchez et al. Of 2017 contradicted the conclusion of ITAR. RAIN outcomes presented pain reduction in kinesiotaping experimental group and was significantly higher when compared to the control group under physiotherapy only. They also found out that kinesiotaping patellar medialization and kinesiotaping lateral rotation of femur and tibia presented 0% tension of initial anchored tape and less than 50% tension and therapeutic zone resulted more pain reduction in patients with patellofemoral pain syndrome. In conclusion, based on the studies presented, kinesiotaping is an innovative therapeutic method that can be used on its own or in conjunction with other treatments. Kinesiotaping appears to provide immediate relief from knee pain, which may help in patient compliance and continued attendance to treatment. However, there are not enough scientific evidences to support this hypothesis on a long-term basis. Thank you, and we hope our systematic review will incite future studies on the effectiveness of kinesiotaping to patients with patellofemoral pain syndrome.